Alright, we're going to talk about some comfort measures that you can use during labor. So these can be done by your spouse, your partner, your doula. Sometimes a nurse will help you out a little bit if you're lacking support in the room at the time. So these can be done in the hospital or at home. I've got a model with me today just to help me kind of show the techniques a little bit. So obviously if you're in a hospital setting or even at home, chances are she's probably not going to be sitting on a kitchen chair. Most likely will be sitting on a ball. She could be sitting on the edge of a bed, the couch, somewhere a little more comfortable would probably be better, considering she's pretending to be in labor right now. So anyways, the first one I would suggest that you start out with is just having her sit, and she can lean forward if she feels more comfortable doing that. Just let her get into a comfortable position on her own, because she is basically going to be your focus, considering she's the one in labor. So once she's kind of comfortable, you can start just touching very lightly and going up and using your fingers softly and going up her neck down onto her shoulders, and then you're going to go up and around her ears and using her temples kind of to relax, and then across her forehead. And something I learned personally for myself, a nurse actually gave me this tip, was when you relax your forehead, it actually makes your whole body kind of relax, because once you start to frown and you scrunch up your face, it kind of tenses everything up. So really trying to help her to relax that forehead just by rubbing back and forth slowly and lightly using just your fingertips. She can let you know if she needs more pressure or less pressure, or it's something that she's not enjoying. Maybe some women might not like that. They might just prefer a cool rag on her forehead and then just massaging her neck and shoulders. You can also use a cool rag and kind of just swirl it near her so that she can get that cool breeze against her, and then go back to the massage just to keep her body just relaxed as possible. So again, you're going to go neck to shoulders, up around the ears, just slowly across the temples, across the forehead, and you can just kind of utilize the forehead area just to really relax herself, and that way the contractions can do their job and get baby to move down. And because she's in an upright position, gravity is going to help with that as well. So the next one we're going to try is, I'm going to show you, is she's going to come around and she would be leaning. We're going to use the chair again, but again, if we were at a hospital or at home, she could lean against the countertop, she could lean against the back of her bed. There's anything that is steady for her to lean against. She's going to put a lot of her weight up on the top of the chair right now, or it would be a countertop or bed, and just kind of use that as a brace to kind of help hold her up. She's going to spread her legs apart a little so that the baby can move down to the pelvis. She can sway if she needs, not necessary, but you can start your massage at her lower back, kind of go up. You're just going to touch lightly. If she needs more pressure, she'll definitely tell you. If she's not liking it, she'll definitely tell you, especially if she's getting close to transition, because that's when the contractions are going to get really hard and strong. So just massaging top to bottom. You can kind of swirl in and out with your hands, and then you can use counter pressure at this point as well, which when a contraction begins, you're going to use the palms of your hands and you're going to put them kind of in the little crevice of her hip where her pelvis is at, the top part of your pelvic bone. And as the contraction comes on, you're going to actually push and squeeze. And when you're doing that, it can get really tiring on your arm. So just kind of use that in stride as she's asking for it. And she might ask for it a lot. She might not really care for it. So just kind of go with what her body language is telling you. And she'll definitely vocalize if it's not feeling good to her. So again, just massaging her back slowly. It's a light touch. If she wants harder pressure, she'll let you know. And then counter pressure as you squeeze in. And if you kind of brace yourself against her and push, it gives you more strength in your arms going this way rather than trying to go like this. So you're going to actually turn inward, and that gives your arms more strength to put more pressure against her. I'm going to show you one more technique Today, we're going to use the chair again. This time she would be down low, whether it be on the edge of the bed, she could be on her hands and knees. And it's similar to how she was when she was over the back of the chair, but this time she's down lower, which takes all the pressure off of her pelvis. So this is a good one to use if like baby is maybe not quite centered over the cervix as you're dilating. It can kind of pull the baby back a little, so that way when she stands back upright, gravity can make sure that the baby's going into the pelvic area straight up and down, because if it's just a little bit off-centered, it's going to give you that lip on your cervix where you're not going to dilate fully. So when she's down here, she's and she has contractions, she may sway back and forth a bit, and then you can massage down on her belly. She may not like that during contractions, so just might need to utilize that in between contractions. You can also put hip to hip and do that counter pressure again with your palm of your hand and just pull in and squeeze and then release as the contraction releases. And this gives you more stability for yourself. It also is going to give your arms a little bit of a break, because it can be kind of tiring if she's really enjoying that counter pressure. So you're able to massage her back down here as well. You can massage hips in and out. You can massage her head from this position. This is it's just a good position if the contractions don't seem to be making any progress for the cervical dilation. It will pull the baby back up just a bit, not enough to stop the contractions obviously, but pull the baby back up a little bit so that when she does come back upright, it's going to let the baby drop into the pelvis properly. And then from here, if she's up and down, she might actually want you to use that counter pressure here and push again. And then again, you can go hip to hip and squeeze and then release. And then this is also a good position if she is comfortable like this. You can use your elbows and just let her kind of fall back onto your body. And she might want to stand on her feet and do that. She might just want to stay on her knees. So those are some comfort measures you can use. Definitely practice at home. You can utilize any of these or a combination of these. These are not the only ones there are lots of them to use. So just whatever the birthing woman is comfortable with, you got to kind of go with. And then she'll definitely let you know her pressure and all of that when you're utilizing these methods.